When you think about ancient medicine, you probably imagine leeches, bloodletting, or someone waving herbs around while chanting to the gods. But what if I told you that thousands of years ago, ancient civilizations were performing surgeries we only recently perfected, or inventing treatments that still baffle scientists today? These aren't myths or exaggerations. These are real, documented ancient medical practices that were centuries, sometimes millennia, ahead of their time. Imagine getting brain surgery with no anesthesia 7,000 years ago. Across Europe, Africa, and South America, archaeologists have found hundreds of ancient skulls with perfectly round holes cut into them, a procedure known as trepanation. We're talking about the Stone Age here. These weren't crude hacks either. Many of the skulls showed signs of healing, meaning the patients survived. In Peru, some ancient skulls show a survival rate of over 80%. Scientists believe trepanation was used to treat head trauma, epilepsy, and even mental disorders. We don't know how they managed to keep the patient alive, but they clearly knew how to work around the brain, something that would terrify even modern doctors without the right tools. A fake toe may not sound like a really big deal until you realize it was custom made and fully functional 3,000 years ago. Discovered in a tomb near Luxor in Egypt, this wooden prosthetic toe belonged to a woman who had lost hers, possibly to diabetes or trauma or who knows what. But what's crazy is how well it was engineered. The toe was designed to bend and flex, allowing her to walk in sandals, which were the footwear of the time. It even showed signs of wear, meaning she used it regularly. Researchers tested replicas of the toe on volunteers and found that it actually did work. It's now considered one of the oldest examples of prosthetic surgery in human history. Over 2,000 years ago, doctors in India were literally removing cataracts from people's eyes with metal tools. The ancient Indian physician Sushruta, often called the father of surgery, described over 300 procedures in his medical texts, including a method for treating cataracts. He would insert a curved needle through the eye and push the cloudy lens out of the field of vision. While it sounds absolutely horrific today, it actually worked to some extent. Patients would then be treated with herbal medicines and covered to protect the eye. This was written down in the Sushruta Samhita around 600 BCE, long before modern ophthalmology even existed. A 6,500-year-old tooth just revealed something dentists didn't expect: the world's oldest filling. In 2012, archaeologists examining a human jawbone from Slovenia found a cracked canine tooth sealed with beeswax. Using x-rays and chemical analysis, they discovered that the wax had been heated and carefully packed into the tooth, likely to ease pain or protect it from further decay. While it's not a full root canal by modern standards, this find proves that even in the Bronze Age, people understood dental pain and had figured out how to do something about it. What if I told you the Romans had surgical kits so sophisticated, modern surgeons could recognize almost every tool? At the house of the surgeon in Pompeii, buried in ash during the eruption of Mount Vesuvius in 79 AD, archaeologists uncovered a complete set of medical instruments: scalpels, forceps, catheters, bone drills, everything made from bronze and steel. Many of the tools look eerily similar to what you'd find in an operating room today. Roman texts also described procedures like varicose vein removal, hemorrhoid treatment, and even C-sections. They even used opium and mandrake as anesthetics. These people were not guessing, they definitely had a system. Nose jobs might seem like a modern trend, but ancient Indian doctors were doing them over 1,500 years ago, and they were actually doing them well. In India, around 600 BCE, surgeons had already mastered a technique to reconstruct noses that had been damaged, lost in battle, or intentionally cut off as punishment. The procedure, described by the same doctor as before, involved creating a skin flap, usually from the cheek or forehead, and carefully grafting it into the nasal cavity. This method required stitching, shaping, and careful bandaging to ensure the tissue would survive and form a natural-looking nose. It is shockingly similar to what's still done in modern reconstructive rhinoplasty. The fact that they figured out how to do all all of this without modern tools, antiseptics, or painkillers shows just how advanced and precise these ancient doctors really were. In Uganda, long before C-sections became routine in Western hospitals, local doctors had already perfected them with astonishing results. In 1879, British medical officer R.W. Felkin observed a Cesarean birth performed by the Banyoro people in what's now Uganda. The entire operation was done with almost surgical calm. The mother was given banana wine to dull the pain, the skin was cleaned with more banana wine, and the surgeon used a sharpened iron blade to open the abdomen. The uterus was cut open, the baby safely removed, and the womb carefully closed with iron spikes. Herbal mixtures were then applied to prevent infection. Felkin couldn't believe what he had witnessed. Both the mother and child survived, and the recovery was swift, all things considered. It wasn't a fluke either. This was a common, culturally embedded technique passed down and refined over generations without ever needing the stamp of Western approval. Some ancient Peruvian warriors didn't just survive traumatic head injuries, they walked around with literal gold in their skulls. In pre-Columbian Peru, especially in the highlands, trepanation was a common practice used to treat head wounds, relieve pressure, or possibly even address mental illness. But what really shocked researchers was the discovery of skulls with metal plates, some of them made of gold or silver, carefully embedded into the trepanned area. These weren't flashy accessories, they were functional implants used to protect vulnerable parts of the brain post-surgery. Even more incredible, CT scans and analysis of the bone show signs of healing and bone regrowth around the plates, meaning the patients lived, sometimes for years after the operation. There's no solid explanation for how they avoided infection, especially without antibiotics, but somehow they did, and it shows an understanding of both medicine and metallurgy far beyond what anyone expected for that time. Acupuncture might seem like a new age wellness trend, but its roots go back thousands of years, and possibly even farther than we thought. Chinese medical texts written over 2,000 years ago detail a complex system of energy channels, or meridians, and the strategic placement of fine needles to treat everything from headaches to arthritis. But here's the twist. When researchers discovered the 5,300-year-old frozen body known as Otzi the Iceman in the Alps, they noticed a strange pattern. He had tattoos on his skin that aligned perfectly with known acupuncture points, especially those related to joint and back pain. Otzi lived long before Chinese texts were written, which suggests that acupuncture, or at least a very similar pain treatment method, may have evolved independently or even earlier than anyone realized. And today, even skeptical scientists acknowledge that acupuncture can relieve chronic pain. That means ancient practitioners weren't just guessing, they were discovering real, effective medicine. Cosmetic surgery may seem like a modern luxury, but the ancient Greeks were already tackling facial issues with scalpels and precision over 2,000 years ago. The Greek physician Galen, one of the most influential medical thinkers in history, documented a surgery to correct ptosis, a condition where the upper eyelid droops over the eye. His method? Use sharp instruments to cut and lift the sagging skin, remove the excess, and stitch it up. An early version of the blepharoplasty, or eyelid surgery, that is still done today. Galen didn't just stop there. His anatomical studies, including observations on the nervous system and circulatory system, laid the foundation for medical education for over a millennium. He was dissecting monkeys and animals to understand how human anatomy worked, and while not everything he believed turned out to be true, his surgical insights were centuries ahead of their time. This guy basically wrote the medical textbooks of the ancient world, and people kept using them until the Renaissance. Alright guys, that has been our list for today. Thanks so much for checking it out. I've been your host today, Olivia Kozlowski, and I will see you again soon. Goodbye.